I've taken some slides from our report released today to highlight a few of our key findings. As Figure 1 illustrates, after a spike in deaths related to heroin in the late 1990s, the annual number of deaths in BC due to illicit drug toxicity remained far In 2013, we saw the first indicator of illicit fentanyl entering the drug trade. In 2016, Dr. Perry Kendall, then the provincial health officer, declared illicit drug toxicity a public health emergency. Since that time, the number of people who have died as a result of drug toxicity in BC has risen tragically and dramatically. In 2020, 1,716 lives were lost. This represents the most deaths ever in a single year in this province due to an unnatural cause and an alarming death rate of 33.4 per 100,000 people. As has been the pattern throughout this public health emergency, the vast majority of those dying are inside a private residence or another residence and are males between 19 and 59 years of age. Males accounted for 81% of deaths in 2020. Illicit fentanyl continues to drive the illicit drug public health emergency and was found in 86.8% of deaths from 2017 to 2020. Cocaine is the next most common substance detected, along with methamphetamine, amphetamine, other opioids, and alcohol. Figure 2 highlights the dramatic impact of the toxic illicit drug market on public safety in BC, with deaths due to drug toxicity far surpassing the number of deaths due to suicide, motor vehicle collisions, homicide, and prescription drug deaths combined. And while many may think that deaths due to illicit drugs are confined to small areas or populations in our province, in fact, people are dying in communities across BC from all walks of life and leaving behind broken-hearted families, friends, and colleagues. This map illustrates the death rates across BC in 2019, with virtually no area of the province untouched by drug toxicity fatalities. In 2020, things got far worse, with the majority of our province experiencing toxic drug death rates of more than 30 per 100,000 individuals. We know that the harm reduction measures implemented had a measurable effect in reducing deaths in 2019. Naloxone overdose prevention sites and supervised consumption sites reversed overdoses, and the number of deaths decreased. Drug checking services helped people assess the toxicity of drugs. With the pandemic, access to harm reduction measures was reduced. People self-isolated, and the harms associated with the illicit drug market returned with a vengeance. In April of this year, BC will have been in a toxic drug public health emergency for 5 years. In that time, we will have lost almost 7,000 people to toxic drugs. With my thanks to Moms Stop the Harm, these photos show the faces of just a small number of those that we have lost. These are sons, brothers, fathers, daughters, sisters, friends, and colleagues. Thousands of years of life and potential are gone. We must turn this terrible trajectory around. What can we do? The findings of our death investigations, death review panels, and inquests have recommended a path forward. First, essential harm reduction services must continue to be available for those experiencing problematic substance use. This includes access to naloxone, supervised consumption sites, overdose prevention sites, and drug checking services. We know that using alone is terribly dangerous. Anyone using an illicit substance should do so in the presence of someone willing and able to administer naloxone and call for emergency medical help. Secondly, access to safe supply. Prescribed pharmaceutical alternatives is essential to reducing the dependence of vulnerable people to a profit-driven, illicit drug market that depends on growing its customer base to increase its profits. Encouraging physicians and nurses to prescribe safe alternatives to their patients will save lives. Third, build a regulated, evidence-based, economically and geographically accessible system of treatment and recovery services in the province that requires all facilities and agencies purporting to provide addiction services to meet evidence-based standards and regulations. Ensure that treatment is available when people are looking for it, no longer accepting wait times of weeks or months for recovery and treatment services that mean the difference between life and death. And finally, end the criminalization of people who are experiencing the challenges of addiction. We know that decades of this punishing and stigmatizing approach have brought us to the devastating place we're in today. Let's work towards eliminating the medical crises, the social disorder, the pain, the loss, and the death by changing our approach from one of punishing and blaming to one of supporting and healing. Let's help. Now I'd like to introduce my colleague, Chief Constable Mike Sir.